Hello, welcome. Here we are at the beginning. I am beginning this broadcast. I am sharing my story. This is a bit of a dream come true, and I'm excited that you're here. Thank you for coming and seeing what this is about. The first guided meditation that has come through for me to offer is the experience of going for surgery. So my experience was I asked my doctor about bariatric surgery, of course, multi-levels before that, but we'll start here. And she said, oh, let's put you on the list to get it done through the province. I'm up in Canada. And so I went through the bariatric program with Alberta Health and learned a lot of things and already knew a lot of things. One of the reasons I chose bariatric surgery, I was turning 40 and I couldn't fit through a room. I couldn't walk across a room. I couldn't do 2 flights of stairs. And I have a need to be very active in the outdoors and seeking a lot of fun. And my bigger body was just really limiting that. So, but I couldn't sort out the messages in my head about, should I eat low fat or keto, high fat? Or do I do cardio hard? Do I lift? Do I yoga? What do I do? So much. My first diet, I believe I was 8 years old when I went to Weight Watchers for the first time. And I'll share different stories along the way, but I've been to them all. I've done them all, and even come up with my own. So that is my experience, and I chose to do the bariatric surgery because at 40 I could not get a clear path. All I knew was my world was much smaller than I wanted it to be, and I needed some help. So I went to the provincial course to learn about not drinking pop, which I really didn't do anyway. So some things were practical and some things weren't. So you're going to go and you're going to learn things that you didn't know, and you're going to reinforce things that you did know, and you're going to let go of things that aren't true anymore and set the intention to find out what's right for you first and foremost. Because otherwise it just becomes another voice, right? Another diet talking to you, another workout program talking to you. And in my experience, that's not what worked for me. In my experience, and my goal of having this broadcast is to invite you to explore within yourself for the answers. That I found that the answers from the outside get confusing. There's too many of them. And this might also just be another message that is confusing to you. However, I really hope it's not. I really hope that it opens doors to your heart, to who you really are, so that that person can come forward and be expressed. It is scary. I have been scared most of my life to be this awesome. And I wonder if you have some of that feeling of holding yourself back because fears of what other people think, and what if I'm really good at everything, and I have to feel shitty about myself so that other people don't feel bad about themselves. Like, if I feel really good, is that going to make somebody else feel bad? We will talk about all those things. But the first experience I want to share is what it's like to go to the bariatric clinic, what kind of things that you'll expect there. And then for my own choice, I decided to go to Mexico, to Tijuana, for the surgery because my time was limited. I was really, if I'm honest, I was really getting close to the edge of the end. And I don't know if that resonates with you. It was desperate times. I had a spot where if I drove my car fast enough and I went off the road at that bridge, would I hit the water? Would I die instantly? And it was on my way to work, so I saw that and thought that most days. So I needed something, and I needed it now. I was in an unhappy marriage. I was at a job where I loved the job, but man, the bosses were bad. You know, some of them were really bad. So I needed some change. And all those pieces fell together. But so just, I say all this because this is my first video and I want to tell you everything. And I know that it doesn't all happen at once. But I think it's from a movie that says, you know, falling in love happens slowly and little by little and then all at once. So that's kind of how this journey feels, is there's small steps after small step and big step and bigger step. And then all of a sudden you're just doing it. And so that's what I really want for you. I want your success. I want you to feel awesome in your skin. And this guided visualization is going to take you through what it's like to go to the clinic, what some of those experiences were like, and then my trip to Mexico. I will translate that visually to you in a meditative state. I'm a trained hypnotherapist. Hypnosis has some power in my story, and I'll share that in another video, but it is something that I truly believe that our minds create our reality, and if we can get in there and create visions of the future that we want, if we know what we want and we can see it, then we can get it. And that is what I'm hoping to offer you today. So get comfortable, take some time for yourself. This might be 15-20 minutes. Have some water, prepare to relax. Give yourself this time to go into the unknown. I'm going to share with you my experience, and it's going to maybe give you an idea of what to expect. So when you're ready, take some deep breaths. You might be sitting or laying down, but you've carved out this space and time for yourself. And so thank yourself for that, for making yourself a priority today, for making this time to visualize the possible future for you as important. This is the first step. This could be your first step on a very, very long and amazing journey. The best is yet to come. So coming into your body, bringing your mind and quieting it down. It's gonna want to tell you things, and you're just gonna say, thank you, I'll get to that later. It might be kicking a little bit to get you to move or to drink or to just settle it down, just like you're putting a little one to bed. Just lay still. Just need to take some deep breaths. And with these deep breaths, one of the ways to find your body, especially if you've been out of your body, which I know in my bigger body I sure was, is to find yourself in space. And to find yourself in space means to notice what's happening on your skin. Is there cool breeze? Are you hot? Are you sitting down? How does that chair feel to your bottom? How does the backrest feels? Are you laying down? Can you feel the earth coming up to meet you? Is there cool air? Do you have tingles? Can you feel your toes? So as you breathe, breathing in the visualization of breathing in golden light. And if you can, there's a little notch here in your collarbone. And if you have to put your finger there, just bring attention to it and just say, I want to breathe through here. Okay, I wear this beautiful stone that I found at the beach to remind me I get through hard things. And I wear it here on purpose to remind myself to breathe in right here. When you breathe in right there, the air, the golden light seems to go everywhere in your body. So feeling your body fill up, maybe like a balloon with golden light. Or maybe you're going to start at your feet and fill up like a glass. Relaxing. Bringing the relaxation from your head. Yawning is a good release. It means that you're letting go of some tension, some stress of the day. Feeling that light that coming in from your crown chakra into your head. So relaxing your forehead, relaxing around your ears, relaxing the jaw, back of your head, your neck. Deep breath in, relaxing your shoulders, letting your shoulders fall down, relaxing your shoulder blades, letting them drop down your back. Feeling the relaxation go down your arms, down your biceps, down your elbows, down your forearms. Relaxing your hands, you might feel them open up. You might want to vision some golden light shooting out from your fingertips. And every time you take a deep breath in, you get twice as relaxed, twice as calm, twice as present with where you are right now. In your body, you are safe. You've put yourself in a place where there's no interruptions. You've turned off the device. You've told people in the house to give you some time. Next breath in, I want you to relax your chest and your back. Your shoulder blades drop down. Breathing a full breath in and relaxing your sides and your belly. Don't hold your stomach in. Let it relax. Feeling your pelvic bowl relax. Feeling some sensation in your spine as it is starting to unwind and relax. Your lower back might be saying something to your hips right now as it's starting to relax. And just allow the unwinding to happen. Just allow your body. And it's okay if you're thinking that you're not getting it right, you are. You can do this over and over again, and each time you will create a new pathway. Just like when something is new, it seems to take longer to get there, or you just notice that it, because there's not familiarity to this maybe, but you're doing great. I'm here to tell you. Relaxing your lower back, your hips, right down to your tailbone. Can you feel that dropping down from your tailbone? And we drop a grounding cord from our root chakra. So at the base of your spine is your root chakra, the color red. That connects you to the earth. It's your safety, survival. Your original cells are there. Letting yawning happen. You might want to sigh. It's okay. Nobody cares what you sound like or look like at this point. Feeling the relaxation in your hips, feeling that grounding cord drop to the center of the earth. You might notice a color coming down. It might shoot out your tailbone. It might shoot out your feet. But you are connected to this earth. This is grounding so that we don't get too off the planet at this time. We want to stay in our bodies on this earthly plane, feeling that connection to the earth and bringing the energy from the center of the earth back up to our bodies. Letting our legs relax, feeling those hip sockets relax, feeling those thighs relax, your hamstrings. Grounding down, your legs getting heavy, your knees relaxing. Your legs might be falling open to one side or just open, or you're just sitting and you can relax. You don't have to hold your legs together. You don't have to hold your stomach in. You don't have to hold yourself in any way. You can turn into jello. You can really relax. It's okay to be soft and squishy right now. To just Let yourself feel into your body, feeling the relaxation all the way down to your feet. Through your feet, thank you, feet, for all that you do for me. Man, my feet have carried my weight. They've carried me far. They've brought me places fast. They're incredible. So along this journey, we have lots of gratitude for our body and the things that it's done for us that we might even not even be conscious of. So thanking those feet that are always helping us hold our ground, stand strong, holding us to this earth. And seeing the light shooting out your toes and feeling each toe relax, almost as though someone is playing this little piggy. So relaxing from your baby toes in to your pointer toe to your big toe, feeling that relax. And bringing that relaxation up through the front of your body to your crown, shooting it up to the sky, connecting to the sun that is above you, and feeling that golden light come in from above and filling you up with golden light. And maybe you'll feel like you're just aware of the inside of your skin. And we've just crossed into the inside of our bodies. And with our mind's eye, with this visualization, we can really go anywhere. And we can explore what it will be like to have surgery. And just telling your body right now, hey body, I've got some big changes coming for you. You know how we've talked for years about eating less and exercising more and loving ourselves and hating ourselves and doing it for this reason and doing it for ourselves and being afraid of the gym and finding new recipes. You know, it's been a journey. But body, this golden, beautiful body that you're in right now, this spaceship that we get to travel all around the planet in. It's an amazing sensory experience, noticing the feeling on your skin, you know, again, touching in, you might be feeling cool. You might smell something in the air. Our eyes are shut so that we can see inside. If there's any sounds outside you hear, just let them turn into the sound of a spaceship, the sound of life, the melodies and the harmonies. You don't have to respond to them. You can just let those sounds be there without having to react to them. Just notice. And I guess that's the core of most of this practice, is to just notice how you can feel different. Notice how by taking a few minutes to get into your body, you might feel more relaxed, more present than you've been in a while. There's nowhere to go. There's nothing to do. You've set aside this time. So with your mind's eye, I want you to see yourself getting dressed in whatever makes you feel powerful. So if that's a beautiful summer dress, or if that's a pair of the jeans that just fit perfectly, if you're a comfort seeker and you've got comfortable clothes on, clothes that are flowy and cool, whatever feels good to you, put that on your body right now. And you might feel some of that going over your head. You might feel some of that coming up over your legs. But try to notice if you can feel something, an awareness in your body of that sensation happening. You know, if I say the word lemon, I start to salivate. I see a lemon. I can cut that lemon. I can bring that lemon to my lips. And I can feel the sensation of salivation under my tongue happening. And that's what we're doing right now. We are using our mind to tell our body how to feel, what to expect. So one of the things that I think holds people back is the unknown. So to be brave, we're going to put on our brave clothes. I wear stars. I get a star every time I do something difficult. Whether that's a conversation or a task or just stepping out of my comfort zone, I get a star. So when you have your perfect outfit picked out and you've got all the things you need, you're organized, the kids get ready easily, you load up and you head to your doctor's office. The appointment has been waiting for you. So you don't have to wait in the waiting room long. You check in and you sit down and you notice the usual magazines with stories and articles that you've read before. 5 tips to reduce your appetite. How do we get past reading articles and into our bodies so that we can find our own steps that we need to take? You're already making the first step today by doing this visualization, and then the next step by going to the doctor's office. And after you've checked in, you sit down. And it doesn't seem to take very long before you're called in. And you get up. Might notice, I'm getting the vision that I hated those chairs with arms. Okay, so I'll get to that. So when I'm in my doctor's office, those chairs with the arms, they were square metal railings that went with like a wooden armrest. And my hips would fit right through there. I could get in, take up the space underneath. So getting up, I had to get up a certain way to release that. We want to experience our bigger body. We want to experience this discomfort so that we know where we are, so that we can know how we're changing. So you get up and you take the few steps and you follow the doctor to the next waiting room where she might weigh you, measure you, and the numbers are what they are for you. Seeing that big number go from 150 to 250, and then the little one going as far over as it needs to go. So whatever number you're at, notice it and say, thank you, scale, for telling me where I am starting from. Thank you for acknowledging that this is where I'm at. I'm at that weight, and it's the last time I will see that number. And you go in and you sit down, you ask your doctor. They might ask, what are you here for? What can I help you with? And you say, doctor, I know I've come. You've been my doctor for years. You know my kids, you know my story. I've been here lots for mental health. I've had Prozac, I've had all the antidepressant meds. I've had meds for my high blood pressure, maybe. I've had a lot of migraine meds. But I'm not here for medicine this time. This time, doc, I'm here for change. And I need some help. Doc, I need some behavior modification. I just can't seem to sort this out. Can I please be considered for bariatric surgery? And your doctor says, oh, absolutely. That surgery has been proven really effective for weight loss, and it can change things like your blood pressure. It can change things like depression. It can heal things like migraine and stress. It can just change your whole life. Say, thanks, doc. Yeah. Just wait for the call. Is there anything else I can do? Well, no, doc, thanks. And so you feel accomplished with that step. You might go back home. You might go to have coffee with a friend and talk about what just happened today. So I asked my doctor about bariatric surgery today. She said Could even help cure my migraines. For sure, my blood pressure will be helped. This pre-diabetes will go away. I'll be able to fit into most of the world again. Ride the rides at the fair. Maybe even start dating. You make your dreams. You sit with that friend and you tell her or him why. What is this going to do for you? Oh, it's going to make it easier to go upstairs. It's going to make it so that I can dress however I want. It's going to make it so that when I look in the mirror, I like what I see. It's going to make it so that my thoughts change from negative to positive, from I can't to I can, from you're fat and ugly to you're fit and fabulous. To reveal the part of you that you are waiting to show this world. The world needs you to carve back some of this fat, this fear, this anger, this trauma that you've put it on to keep yourself safe. Maybe you were in a home that you couldn't be heard or seen. Maybe weight was a way to insulate yourself from insults that were thrown. It was the cause and the cure because it just seemed to give the bullies another target. We're going to let it go. We're not going to let them make us feel bad about ourselves anymore. They're wrong. I am worthy. I am strong. I am powerful. I am beautiful. I am healthy. I am worth making this change for. I want to live a life full of adventures. I want to live a life where I can be free and not be out of breath. I want to explore things farther than the backyard. I want to climb hills. I want to see what it's like to see the world from a mountaintop. I want to fit into an airplane seat. I want to buy the cutest clothes. I want to not be the biggest one in the room. Make your dreams. Fill your lists of what it's going to feel like to be fit. What it's going to be feeling like to let that weight go. What it's going to feel like to wake up and not have to use momentum with your legs to get out of bed, but to have the ability to move your body around, to play with your kids, to play sports with friends, to fit in a chair. And the day comes when it's time to go to the hospital for the bariatric clinic. You've done your homework, you've read the emails, you journaled your food for the 2 weeks that you needed to do. You wrote it all down, even if it wasn't perfect. You were honest with yourself. Set the intention to be really honest with yourself right now, because you know what? You can keep yourself safe. That your honesty with yourself is worth more to you than anything else at this time. And you know, if I'm honest with myself, I know I can do this. I know that I could probably figure it out without this surgery, but right now I feel I just need it so that I can lose some weight, so that I can move better, so that I can get a head start on this journey. And so again, you get ready. You get childcare for the kids. You get the dog walked before you go. You pack some healthy snacks in your water bottle. You got your carrot sticks and some fresh water. And you're curious who you're going to meet. Maybe you're going to make a new friend in this course. Somebody who's a support system, somebody who gets it just like you do. And this time, it's different. You just know it's going to work. And in the past, you've walked into diet centers and seen that the secretary is struggling with her weight, and you think, well, if it's not going to work for her and she works here, how is this going to work for me? It's not the case here. You know that this is going to work for you. You go in, and the nurses are fit, they're healthy, and they're fun, and they're positive. And they're not perfect, but they are people you can relate with. And they've got great slides with great education. It's not the food pyramid anymore. And it sort of is. Knowing that these are guidelines and maybe all these instructions will fall into place. You don't have to memorize it. You just have to trust that what you need to know, you will absorb. You write down some notes. You do some more homework. You learn that if you keep your green onions in tin foil, they last fresher longer. And you might notice that there really are a lot of pop drinkers in the group because they can't help but ask questions about what if, what about diet pop? When can I have it again? And you start to notice that what's in your mind? What are you concerned about giving up? What is something that you've held on to as a bit of a comfort? Salt and vinegar chips here for me, I have to be honest. If I opened a bag, even if it was family size, I found my way to the bottom. But it hurt me. If I really notice, my mouth would hurt and I wouldn't feel so good. And in some ways I felt better. Knowing that we're gonna have to face some of these changes, some of these things we don't want to give up. It's just for a little bit, I promise you. If you have any questions, you can ask them. And when you ask the question, all of a sudden there's a screen in front of you where the PowerPoint presentation has been. And when you ask a question like, how long until I eat solid food? And you get the answer back, 3 weeks. You think, oh, okay. Anything you need to ask, the answer is going to show itself on the screen to you now. So take a few minutes and ask energetically your questions. And if the answer doesn't come on the screen, that's okay. It will come to you soon. And one of the things that you notice about this bariatric clinic, for the first time, you notice that there are chairs of all different sizes. The chairs in this clinic don't have the arms where your hips get pressed in on you. They have chairs without boundaries. They've got sizes of all different like I feel like I could fit here. It's the most wonderful place. So you notice that your stress starts to relax, and that you notice that maybe you're amongst people who are like you, people who are in a bigger body and who are ready to find their way into a fitter body and a world ready to be explored. You feel good about this experience. You learned more than you thought you did. And it reaffirmed that, yeah, you already know a lot. And actually, you've been doing pretty good since you made the decision and doing the 2 weeks of writing it down. You've done really good. And you feel a bit of relief that this isn't your typical eat less, exercise more. That it's not going to be based on your willpower. You will have the support you need to do these big changes that, well, it's a choiceless choice at this point. In order to live and live well, you've got to change your body. Feeling that energy of changing your body move through your body, bringing that energy up from the ground. You might want to say, I'm a changing woman. I'm a changing man. I'm a changing human. And affirmations are so important. If you can start, I like Doxy and I like Brian Scott, anything for manifestation where you can visualize yourself in that state. And that's what we're doing here. So it's almost like you went into the clinic in your big body, and you know that when you walk out, after your check-in, you'll be walking out with your fit, best self body. Now you might choose to visualize yourself in the hospital near you, or you might travel internationally, medical tourism. So you're nervous about the plane. You've got your plane ticket, you've got your appointment. You've been through the clinic, you've read the notes, you've read the book. And so now, with your suitcase packed with just a few things, you head out the door to the airport. And in a way, when that door closes behind you, you know that you are not going to come back the same person who's leaving. And there's some feels to that, and that's okay. You know that the people around you know that you're going to change, and they're not sure what to expect either. And that's okay. Because anything is possible, and you get to choose it the whole way. And we're going to choose the things that make us smile. We're going to choose the choices that sound like fun. I promise you. You head to the car, you load your suitcase up in the back, and then you get into the seat, and you notice you do up the seat belt, and you look down at your belly and you say, body, I love you, and we're going to change. We must. Because staying like this, well, it just doesn't fit who I am anymore. Get to the airport, maybe you're dropped off, maybe you park and walk in, maybe somebody's with you, maybe they're not. You check in, you're just taking carry-on, so you move in, move along, security's easy, and you fly. You get into the plane, you ask for your seatbelt extender, and you know that you'll probably need one on the way back, but after this trip, you're not going to need a seatbelt extender anymore. You're not going to feel the pressure of that arm squeezing you into that seat. You're not going to be worried about having your body touch the person next to you because you're over your halfway mark. You're not going to have to worry about taking up too much space and trying to squeeze yourself into spaces that are too small for you anymore. The flight is easy and beautiful. You land wherever it is. Mine was San Diego. And walking off the plane, it was easy to find the driver that the clinic I went through sent for me. And me and another 2 people load up, and we're driven easily across the border and to the hotel, which is a lovely hotel. It's got a pool, the rooms are clean and nice. You're on the liquid diet, so you're not going out to dinner. You decide to maybe just rest tonight. I think you've got some clear broth and a popsicle to have for your last meal. And as you lay in that bed, maybe it feels like where you're laying right now. And if you're a praying person, you might say a prayer. If the way you talk to the greater power, however you do that. But let's just ask for safe passage into this unknown. Grant the surgeon wisdom and steady hand. They're some of the most experienced surgeons who are doing your operation. The best anesthesiologist is there. The nurses are going to be kind. You just sort of drift off to sleep, imagining how good it's going to be tomorrow and going to go smoothly. Segment intending the best for you. You wake up, you have the best night's sleep. You wake up refreshed, have a shower, skip breakfast, and find your way downstairs to where your ride is waiting for you to take you to the hospital for your surgery. You and maybe another person are waiting for the same ride, and you chit-chat a little bit and find out where each other's from and what you're looking forward to, how your life is going to change, how your dreams are going to come true. And the ride to the hospital is a few blocks. It's an easy drive. And you're dropped off in front of the hospital and you go in. And this whole hospital is basically bariatric. So there's a couple different clinics there, and you find the one that you're looking for and you check in and they give you a package, and you might wait for a little bit before somebody comes to get you. And you go in and you meet the surgeon and you have a conversation briefly, and then you're shown to your room. It's on a different floor, so you can visualize yourself going up in the elevator with your little overnight bag and a bunch of excitement and a bunch of emotion coming with you, and that's okay. It's okay if fear came with you. It's okay if excitement is there too. Everybody's welcome in this elevator, all your feelings, because it's a lot. It's the first day of the rest of your life. So you get shown to your room. The nurse's station welcomes you and they put you into the room. The room I was in by myself with my own washroom, a tiny TV hanging on the wall in the most amazing color of green I'd ever been in. And your head might be busy. Just try to remember the end goal. Instead of worrying about anything, just know that this experience is going to change your life. So you settle in, you take off your clothes and you put on the gown, and you chill out for a little bit, maybe read a book, maybe meditate, maybe pray. And it's not long until they come and get you and take you into the room where you relax, you lay down on the bed, and the anesthesiologist, they take your blood pressure, and the anesthesiologist starts to look to put an IV in. You've had an EKG. Make sure your heart is good. Everything's a go for you. You're in really good health for this surgery today. So the IV goes in with a bit of a poke, and they start the IV, and it doesn't take long till you're asleep. You might start to pray and not even finish the first line. And you go into a relaxed state, and I'm going to guide you through what happens in your body. While you're laying there, they will make 3 or 4 little incisions on your stomach. And one of the reasons you needed to be fasted was to shrink your liver to make more space. And they're going to pump you up with gas to create some airspace in and around your organs. So as you're laying there, can you use your mind's eye to maybe visualize this happening? A tiny little slice on your side, a tiny little slice by your belly button, maybe another slice up under your rib. And as your belly expands with air and the space around your organs gets made, they laparoscopically go in with special tools to work on your stomach. And so if you could see almost like tongs grabbing your stomach and moving things around so that they can get a good vision. One of the tools that's inside you is the camera. There's about 4 or 5 people around you. One of them's running the camera, one of them's running your IV, one of them's running, the tongs, and one of them might be running the cauterizing scissors. So for me, I had bariatric gastric vertical sleeve, and that's where they cut 85% of your stomach stapling. And so I want you to envision your stomach there. I'm sure from all the learning you did in the bariatric clinic, you know that your stomach shape, what it is, and it's pinkish color, and there's a bit of a gut, a brain in your guts, and some hormones. And so telling your body to prepare those sites, to prepare them to move to the other side that's going to be left with you. And if you're having bypass, that's, I believe, where they cut your stomach at the top and they attach the esophagus and sphincter right to your your upper intestine. But visualize this happening. Visualize the tongs grabbing part of your stomach and the cauterizing scissors doing slow cuts, very nice and steady, up your stomach to remove about 80-85% of it. And that gets pulled out through the incision by your belly button, which is maybe the bigger one of them all. And as that cut your stomach, it cauterized so you don't bleed. And just at this moment, send healing light, almost like the gold for the Japanese pottery. See gold going on that cut where they cut your stomach away and removed part of the organ to create a smaller pouch for you. And letting go of the past, letting go of anything that you want to put in that other half of the stomach, the need to overeat, the hungry heart can be taken out, the emotional eater, the comfort food, the impulsive addict, all can be removed from that part of the stomach. And it's put onto the table and they do some checks. They check to make sure that nothing else got bumped. Your heart is still pumping strong. Your lungs are still breathing. Your liver is fine. You can still see lots of fat in and around there too, but you know that that's part of what's going to be released. And so just taking a moment to explore inside your cavity, inside your belly, and tell your body, you are safe. I'm taking care of you. This is what we're choosing to do to change our life. And when the surgeon feels satisfied and the other assistants have done all of their checks and balances, and everything inside you is perfect, it's clean, all your organs are pink and juicy and maybe gold and healthy, do a check on your heart, it's beating strong, your lungs are bubblegum pink, You are this brand new healthy body to get fit and to work with. This is the body you're taking forward into your future. This is the body that will climb the mountains. This is the body that will swim in the rivers. This is the body that will make love. This is the body that will absorb the sun, that you will be nourishing when you feed it. When you feel ready, you can pull those tools out. You can seal those incisions with gold. Some of them may need to have a drain, which looks like a little tube to a little suction ball, like a turkey baster, with a tube. And usually they put those in for the first day or so. And your belly is still very distended because of the gas, but your surgery was a success. And in a few short hours, the anesthesia will wear off and you'll be moved back into your room where you can rest and recover. You'll do a liquid test. So visualizing yourself being taken off the surgical table back into a hospital bed and transported to your room where you are sleeping. The pain meds are working to ease the pain. You notice that your body feels really big right now, and that's okay. It's okay, because this is the last time you will ever feel this way. It's hard to move. There's not the strength to move this big body right now. You've been starving before this surgery, and it's going to be a little bit of a tough road after too. All your normal pattern is broken, and that's okay. It's okay for things to change. The nurses come in with frequency to take your blood pressure and ask you how you're doing. You've got some water to sip. You're able to go to the washroom. If you can fart, do so. If you can belch, do so. And after about 6 hours of sleeping, they say it's time to get up and go for a walk. So your super sexy self in the super sexy hospital gown that ties up in the back, but probably not all the way. Don't worry, everybody else has it all hanging out too. You might as well laugh about that. Don't take yourself so seriously. You and your IV cart go for a walk. And it's hard. It's hard even to walk to the washroom. Coming off the anesthesia, little unsteady, so take it slow. Small steps, ask for help if you need it. But you let a big fart rip, and there's some relief. You empty your bladder, and you know that emptying your bowels needs to be done before you leave, but you're not ready yet. I had a really bad migraine. You might have some pain in addition to the surgery pain, like a headache or some sort of stress response, but that's okay. Ask for medicine if you need it. The nurses are wonderful. They bring you fresh water, some ice chips, whatever you need. And you take a little walk, and maybe you walk 4 doors down on the right, and then you turn around. And there's a few other bariatric patients doing laps, and you realize it's not a race. Everybody is going their own pace. And some people are there with their partners, and some people are there by yourselves. Whatever it is for you, it's right. But you take your steps, and you let go of what you need to let go of. You can head back to your room for some more rest. And if you need anything in the night, you ask for it and you get it. If you need another pillow for under your knees, ask for it and get it. If you need anything, ask for it, you get it. And the next day, they do the liquid test. They come get you, the leak test, and you drink some Technicolor gunk. that shows up in the x-ray. And so you go into another room and you drink it, and then a couple minutes later, you're standing in front of a machine that's taking an image, and that's about it. They'll probably give you that on a CD before leaving. And because your surgery was such a success, perfect in fact, you don't need to spend another night. They take out the drain, which sort of feels like pulling the thread on a sweater. And you take your little bag and you sign out. You meet your friend or whoever's there with you, or if you're by yourself, you just walk down to the shuttle driver who drives you back to your airport, to your hotel, where you check back in, all covered under the package. Don't worry, there's no extra expense. You might have a nap, or you might read a book by the pool. You might put your legs in the pool. You don't want to get your incisions wet just yet, but you can drizzle your legs in the pool, drinking, sipping on that water, taking really good care of yourself. And they're going to send you with a breath tester. I don't know, I want to say it's like a bong, but instead of sucking, you blow. And so you blow so that this little bean goes up into this tube so that you can breathe out a certain amount of pressure. So you got to practice that so we can take our deep breaths and to keep our lungs moving in healthy ways. But other than that, you've had a successful bariatric surgery. And in another good night's sleep here, you will be headed back to your home to start the next part of the journey of this weight loss experience that is the most exciting adventure you'll ever go on. With a deep breath, feel yourself back in your own body, maybe back in your room, back in your house. Knowing that this surgery was a success, knowing that there's no complications, you don't need to ever go back again for a revision. You're not going to suffer from GERD. You've had the most perfect surgery. Your body knew what to expect. Your body heals magically because you put that gold on there. And because our thoughts create our reality. You know, nobody told me how to heal the cut on my finger. My body just knows. And your body just knows that when you say, body, heal this quick and easily, it does. And so you have a super positive experience. Within a couple days, you will start to feel as much like yourself as you can and be ready for the next step and the next meditation that we'll do. Just arriving back into your body. I'd like you to do some figure eights with your eyes, doing them this way 4 times. And then flip it up and down. Deep breath in. Moving your eyes, and then forwards and backwards, if you can move your eyes that way. You are powerful and strong. You are a miraculous being. Your body heals in the most phenomenal ways. This surgery is going to be the best thing you've ever done. It's going to change your life, and the best is yet to come. Come up with some real positive affirmations. I'd ask you to write on your mirror, I love myself a lot, or I'm a miracle, whatever feels true for you. But arriving back in your body, back in your skin, back in your room, wiggling your toes, starting to feel that energy, wiggling your fingers. Couple deep breaths. Opening your eyes and coming back. Thank you for taking this journey with me. Thank you for exploring the power of our mind to visualize possibilities. Doing this meditation over a few times before your surgery will definitely guarantee a smooth, easy experience for you and set you up for the most positive, healthy experience you could have. So if you have any questions, reach out below. Please, I'll say all those things that every YouTuber says. Like and subscribe, share it with your friends. Ask me questions. If you do, I will answer them. And here's to those first important steps. This step is maybe the most important one you take, the one where you start. You got this. You are strong. You are amazing. You go all the way. There's no stopping you. There's nothing you can't do.